In this video, we will be discussing about the ischiorectal fossa and its boundaries. So, ischiorectal fossa. First, coming to the lateral boundary. Lateral boundary is formed by fascia covering the obturator internus muscle. This is the obturator internus muscle and fascia covering the obturator internus muscle and the ischial tuberosity that forms the lateral boundary. Then the medial boundary is formed by fascia covering the levator ani muscle and the external anal sphincter. Levator ani and the external anal sphincter fascia forms the medial boundary. Then we have the floor and the roof. The floor is formed by the perineal skin and the roof is formed by the meeting point of these two fascia which were forming the lateral and the medial boundary. Then anteriorly and posteriorly. Anteriorly we will be having posterior border of the perineal membrane. Anteriorly we will be having, this can't be shown in the image, you have to just imagine. Anteriorly we will be having posterior border of the perineal membrane and posteriorly we will be having sacrotuberous ligament. Sacrotuberous ligament. Then we once again we see this image. Okay, this is the inferior rectal coming from the pudendal canal. We have seen the pudendal nerve video. Then this is pudendal canal containing the inferior rectal, that is pudendal vein, internal pudendal artery and nerves. Okay, then this is ischioanal fossa, obturator internus, levator ani, external anal sphincter and internal anal sphincter. These are the anal columns and in between anal walls are there and in between them anal columns are there. So that is about ischiorectal or ischioanal fossa. Then we also study the blood supply of the rectum. So blood supply, first we see the arterial supply. It is same in the arterial and the venous supply. We have the superior, middle and inferior rectal veins and arteries. Okay. Superior rectal artery. Superior rectal artery is a branch of inferior mesenteric artery. Similarly, superior rectal vein will be draining into inferior mesenteric vein. And what regions it will be draining? Upper anal mucosa, internal sphincter and conjoint longitudinal cord. Then coming to middle portion is middle rectal artery and it is originating from internal iliac artery. Internal iliac. Similarly, middle rectal vein will be draining into the internal iliac vein. Then is inferior rectal artery. Inferior rectal artery is a branch of pudendal artery. Anything linked with inferior rectal, whether artery, vein or nerve, it is related to the pudendal. Then inferior rectal vein is a branch of internal pudendal, means inferior rectal vein will be draining into internal pudendal vein. And that is draining the lower anal mucosa and the external sphincter. So what we need to remember is superior is from inferior mesenteric, middle is from internal iliac and the inferior is from the pudendal. That we need to remember regarding the blood supply and the venous drainage of the rectum. So that was all about the ischioanal fossa and the arterial and venous drainage of the rectum. Thank you.